All right, so here today with Greta, and basically Greta showed up today to do our weekly blog, and she showed up and asked me about knee pain. So she's doing some lateral lunges. She's got some knee pain on the outside of her kneecap, on the outside on the right, and so when she was doing lateral lunges, she has pain. This is a pretty common situation with female athletes, right? So basically, Greta came in and said, I have pain, what do I do about it? And I talked to her, and the first thing she said, well, maybe I should do more glute work. And my response to her was, well, maybe not, because glute work may actually be the problem here. And as much as we all are in love with doing glutes, and they're really important for us, for athletes, sometimes we can overdo it. And so here's what's happening. If I have her scoot over just a little bit more towards me, basically what happens is we have something called the IT band, iliotibial band, and it attaches to the top of the pelvis, goes all the way down the side of the leg, past the knee, and it is a real thick band. And what can happen is this band can basically, because of that and the connective tissue into the kneecap, the patella, when it gets short and tight, it can actually pull the kneecap to the right. And when it pulls it off, instead of tracking where it's supposed to on the femur, it starts to pull to the side. Her kneecap's already going that direction. So the pain she's getting is because her kneecap's going to the right. And basically what you need to know is the glute muscles, right, the hip and butt muscles actually attach into the IT band. So if we do more glute work and that goes into the IT band, that's probably going to make this situation worse, right? So what's the fix to this alignment or tracking issue? We're going to start with trying to do a release on the IT band, and the best way I know to do that is to use a foam roller. So I'm going to have her roll on a foam roller on the side, and she's going to lay on her right side, a soft foam roller in this case, and she's just going to roll an inch or two above right over the knee. And generally, if this is what's going on, if this is kind of lit up, it's probably very painful. We've already done this today. And yeah, when she first laid down on it, she looked at me and wanted to scream. And I said, it's okay. We're rolling on the IT band. We're going to go 20 to 30 seconds up and down. It's not going to feel good. It didn't. And then get right over that point where it's kind of the most painful on the IT band, and now roll it side to side. So she's just going to roll forwards and backwards on it, right? She's kind of rotating her leg forwards and backwards on that spot. It's not going to feel good. Then, so 20 to 30 seconds up and down, 20 to 30 seconds side to side. I have you stand back up. And basically what I'm hoping is that relax some of the IT bands, pull sideways on the kneecap, and now as she does a regular squat or lunge, or a sideways lunge, lateral lunge in this case, go and do a lateral lunge again. Now as it comes back down, if this is actually relaxed, it's allowing the kneecap to go back into where its normal alignment over here instead of over here. And she said it felt better, okay? So step one part of the fix is not more glute work, it's actually to release the IT band, and then the next part of this is doing like a split squat with the right foot in front, because we've got a muscle balance issue here. We've got too much going on the outside, and what we're forgetting about is the inside of the quad and the adductors on the thigh that actually want to help pull the kneecap back that direction. So she's going to do a little split squat, and in the perfect world, I'd have her looking forwards into a mirror, and I'd have her looking at her knee and not allowing that knee to go out to the outside. Now, she's going into a deep lunge or deep squat. I don't want her to go that low. The vastus medialis here on the inside that I'm trying to target works really kind of on this last 15 degrees. So I only want her to go down 15 or 20 degrees and come right back up. And I want her to feel, and I'm going to cue her, I want her to feel that inside quad and then the inside part of her thigh muscles working, because they're in a dance over here with the glutes and the IT band trying to help that kneecap track. So we're going to do 10 reps, and once again, she's just focused on making that kneecap track up and down, okay? What's it feel like now?
Feels a lot better.
Yeah.
It's getting tired right there.
Yeah, cool. So she's saying that inside's tired because she's been doing so much glute work on the outside, probably hasn't been stretching like she should, so all this is tightened up. The fix is not the glute more work, it's to relax glute, IT band, get the inside working, get the tracking back where it should be. That's it for today. If you like this video, please like it down below. Subscribe to our channel if you'd like. If you want more information about our products, go to powercore360.com.